Bronchitis, a common respiratory illness, affects millions each year. It's an inflammation of the bronchial tubes, causing a persistent cough and mucus production. Acute bronchitis is usually caused by a viral infection and resolves within a week or two. Chronic bronchitis, often linked to smoking or prolonged exposure to irritants, requires ongoing management. Understanding the causes, symptoms, and treatment options can help manage the condition effectively. Let's dive deeper into the symptoms and types of bronchitis. A persistent cough is a hallmark symptom of bronchitis, often described as chesty or hacking. This cough is the body's defense mechanism to clear the airways of excess mucus and irritants. The severity and duration of the cough can indicate the type of bronchitis. Consulting a healthcare professional is essential for proper diagnosis and treatment. Besides a persistent cough, bronchitis can present with wheezing, shortness of breath, chest tightness, fatigue, low-grade fever, and headaches. These symptoms can mimic other respiratory illnesses, making medical advice crucial for an accurate diagnosis. The severity of symptoms depends on factors like the underlying cause, overall health, and age. Consulting a healthcare professional ensures an accurate diagnosis and appropriate treatment plan. Bronchitis manifests in two primary forms, acute and chronic. Acute bronchitis, often a chest cold, develops rapidly and lasts a few days to a couple of weeks, usually caused by viral infections. Chronic bronchitis is characterized by a persistent cough producing mucus for at least 3 months in a year, for 2 consecutive years. It's caused by prolonged exposure to irritants like cigarette smoke, air pollution, and chemical fumes. Chronic bronchitis can significantly impact lung function and overall health if left unmanaged. Understanding these differences is key to effective management. Acute bronchitis is overwhelmingly caused by viruses, often the same ones responsible for the common cold and flu. These viruses spread through respiratory droplets when an infected person coughs or sneezes. The body initiates a cough reflex to clear mucus buildup, resulting in the characteristic cough. While viruses are the primary cause, bacterial infections can also play a role, though less common. Consulting a healthcare professional is crucial to determine the underlying cause and receive appropriate treatment. Chronic bronchitis arises from prolonged exposure to irritants causing chronic inflammation and damage to the bronchial tubes. The most significant risk factor is cigarette smoking, which leads to chronic inflammation and excessive mucus production. Other irritants include secondhand smoke, air pollution, dust, and chemical fumes. Occupations exposing individuals to these irritants increase the risk of developing chronic bronchitis. Certain factors increase the risk of both acute and chronic bronchitis. For acute bronchitis, a weakened immune system, exposure to irritants, and close contact with infected individuals are key risk factors. Chronic bronchitis is primarily caused by smoking, responsible for up to 90% of cases. Complications can range from mild to severe, including pneumonia, respiratory failure, and heart problems. Pneumonia is a more serious lung infection that can be life-threatening. Chronic bronchitis can lead to respiratory failure, where the lungs can't provide enough oxygen. It can also strain the heart, increasing the risk of heart failure and other cardiovascular problems. Most cases of acute bronchitis resolve with home care, but seek medical attention if you experience difficulty breathing, high fever, coughing up blood, wheezing, or symptoms lasting longer than 3 weeks. Early diagnosis and treatment are crucial for managing bronchitis effectively. Your doctor can determine the underlying cause and recommend the appropriate treatment plan. This may include medications, breathing treatments, or lifestyle modifications. Bronchitis announces itself through a variety of symptoms, often leaving you feeling drained and uncomfortable. A persistent, productive cough is a primary indicator, bringing up mucus or phlegm. This mucus traps irritants and pathogens, but can lead to discomfort and difficulty breathing. Wheezing, a high-pitched whistling sound during breathing, is another common symptom. The cough, often perceived as an annoyance, plays a crucial role in defending our respiratory system. Initially, the cough might be dry and irritating, especially at night. As the condition progresses, it typically transitions into a productive cough, bringing up mucus. The color of the mucus can provide insights into the nature of the infection. Clear or white mucus is often associated with viral infections, while yellow or green might indicate a bacterial infection. Consulting a healthcare professional for an accurate diagnosis is crucial. Shortness of breath or dyspnea is a distressing symptom characterized by difficulty breathing. In bronchitis, it arises from airway obstruction caused by inflammation and mucus buildup. Severe or worsening shortness of breath warrants immediate medical attention. If accompanied by chest pain, bluish lips or fingernails, or a rapid heart rate, seek emergency care immediately. The mucus produced during a cough can offer valuable clues about the underlying cause of bronchitis. Clear or white mucus is frequently associated with viral infections, while yellow or green might suggest a bacterial infection. The consistency and odor of mucus can also be revealing. Foul-smelling mucus, particularly with a fever, could indicate a bacterial infection requiring antibiotics. Bronchitis shares symptoms with other respiratory illnesses like the common cold, flu, and COVID-19. The common cold presents with a runny or stuffy nose, sore throat, sneezing, and a mild cough. The flu includes high fever, chills, body aches, headache, fatigue, and a dry cough. COVID-19 shares symptoms with both, but can also cause a loss of taste or smell. Accurate diagnosis is crucial for effective management. Seek professional medical advice to differentiate between these illnesses. Acute bronchitis, primarily caused by viral infections, is highly contagious. These viruses spread through respiratory droplets when an infected person coughs or sneezes. The contagious period typically aligns with the duration of symptoms. Some people can be contagious even before symptoms appear, while others might remain contagious for a short period after symptoms subside. Understanding the contagious nature is crucial for implementing preventive measures. Acute bronchitis spreads through close contact and respiratory secretions. Imagine a person with bronchitis coughing, releasing virus-laden droplets. These droplets can be inhaled, leading to infection. Touching contaminated surfaces also spreads the virus. An infected person touches a doorknob, depositing the virus. You touch the same surface, then your face. Congratulations, you've just given the virus a free pass. Unlike its contagious counterpart, chronic bronchitis is not caused by an infectious agent like a virus or bacteria. Instead, it stems from prolonged exposure to irritants that damage the airways over time, leading to chronic inflammation and mucus production. These irritants, such as cigarette smoke, air pollution, and chemical fumes, are not contagious in the traditional sense. While chronic bronchitis itself is not contagious, the underlying lung damage it causes can make individuals more susceptible to respiratory infections, including acute bronchitis. This increased vulnerability arises from the compromised ability of the damaged airways to effectively clear mucus and fight off infections. So, while you can't catch chronic bronchitis from someone else, it's crucial to be mindful of the shared risk factors that contribute to its development. If you have chronic bronchitis, taking steps to prevent respiratory infections, such as frequent hand washing and avoiding close contact with sick individuals, is paramount. Section 4. Protecting yourself and others. Breaking the chain of infection. Preventing the spread of acute bronchitis requires personal hygiene, respiratory etiquette, and responsible behavior. Hand hygiene is crucial. Wash hands with soap for at least 20 seconds. Use alcohol-based sanitizer if soap isn't available. Cover coughs and sneezes with a tissue or elbow. Section 5. Special considerations: infants, elderly, and immunocompromised individuals. Infants, the elderly, and immunocompromised individuals are more vulnerable to severe illness and complications from acute bronchitis. Protecting these groups requires extra vigilance and proactive measures. Infants have developing immune systems and smaller airways, making them susceptible to respiratory infections. They may experience severe symptoms and require hospitalization. The elderly face increased risk due to age-related immune decline and health conditions. Staying up to date on vaccinations is crucial for older adults. Immunocompromised individuals struggle to fight infections effectively. Acute bronchitis can lead to severe complications for them. Section 1. Prevention is key: shielding yourself from bronchitis. Bronchitis, while a common ailment, can disrupt your daily life with its persistent cough, chest discomfort, and overall fatigue. Fortunately, many cases of bronchitis, particularly acute bronchitis, can be prevented by adopting simple yet effective preventive measures. These strategies focus on reducing exposure to infectious agents, boosting your immune system, and minimizing airway irritation. Think of bronchitis prevention as a two-pronged approach. First, protecting yourself from encountering the viruses and irritants that cause bronchitis. And second, strengthening your body's defenses to fight off these invaders effectively. By incorporating these preventive measures into your daily routine, you can significantly reduce your risk of experiencing the unpleasant symptoms of bronchitis. Remember, prevention is an ongoing process, not a one-time event. Just like you wouldn't wait to feel thirsty before drinking water, don't wait to get sick before practicing preventive measures. By consistently incorporating these strategies into your life, you can create a protective shield against bronchitis and other respiratory illnesses. Section 2. The power of hygiene, your first line of defense. Good hygiene practices might seem like common sense, but their importance in preventing the spread of infectious diseases, including acute bronchitis, cannot be overstated. Imagine your body as a fortress, and hygiene practices as the vigilant guards protecting its gates, keeping invaders at bay. Hand washing, often dubbed the do-it-yourself vaccine, remains the simplest yet most effective way to prevent the spread of germs. When you wash your hands with soap and water, you're not just rinsing away dirt. You're creating a slippery surface that dislodges viruses and bacteria, sending them down the drain. Remember to scrub all surfaces of your hands, including the backs, between your fingers, and under your nails, for at least 20 seconds. Humming the happy birthday song twice can help you keep track of time. If soap and water aren't readily available, use an alcohol-based hand sanitizer containing at least 60% alcohol. Section 3. Vaccination, arming your body for battle. Vaccines, often hailed as one of the greatest public health achievements, play a crucial role in preventing infectious diseases, including those that can lead to bronchitis. Think of vaccines as training simulations for your immune system. They introduce a weakened or inactive form of a virus or bacteria, allowing your body to recognize and develop defenses against it without causing the actual illness. The flu vaccine, recommended annually for most individuals, protects against influenza viruses, a common cause of acute bronchitis. While the flu shot doesn't guarantee you won't get sick, it significantly reduces your risk of contracting the flu and experiencing its complications, including bronchitis. Another important vaccine for preventing bronchitis is the pneumococcal vaccine, which protects against Streptococcus pneumonia, a bacterium that can cause pneumonia, another respiratory infection that can lead to bronchitis. The pneumococcal vaccine is particularly important for infants, young children, older adults, and those with weakened immune systems. Section 4. Lifestyle modifications, building a fortress of health. While hygiene and vaccination provide external protection, certain lifestyle modifications can fortify your body's internal defenses, making it more resilient against infections like bronchitis. These modifications focus on boosting your immune system, reducing airway irritation, and promoting overall well-being. One of the most effective ways to strengthen your immune system is to adopt a healthy lifestyle. This includes consuming a balanced diet rich in fruits, vegetables, and whole grains, which provide essential nutrients that support immune function. Regular exercise also plays a vital role in boosting immunity by improving circulation and strengthening the body's defenses. Conversely, certain habits can weaken your immune system, making you more susceptible to infections like bronchitis. Smoking, for instance, damages the delicate lining of the airways, impairing their ability to fight off infections. Similarly, chronic stress can suppress the immune system, increasing your vulnerability to illness. Section 5. Navigating public spaces. Outsmarting germs on the go. Public spaces can be breeding grounds for germs, making it challenging to avoid exposure to infectious agents. Adopt practical strategies to minimize your risk of infection. Be mindful of high-touch surfaces like doorknobs, handrails, and shopping cart handles. These surfaces can harbor germs, increasing your risk of infection. Avoid touching your face, especially your eyes, nose, and mouth. Wash your hands or use hand sanitizer first. Consider wearing a face mask in crowded public spaces. Section 1. The importance of respiratory awareness. We often take our respiratory health for granted, breathing in and out without a second thought. Yet, as we've explored throughout this discussion on bronchitis, our respiratory system is a complex and delicate ecosystem, vulnerable to a myriad of threats, from microscopic invaders like viruses and bacteria to environmental irritants that silently chip away at our lung function. Bronchitis, in its acute and chronic forms, serves as a stark reminder of this vulnerability. It highlights the importance of respiratory awareness, not just during flu season or when we feel a tickle in our throats, but as an ongoing commitment to protecting one of our most vital bodily systems. Just like we prioritize heart health with regular exercise and a balanced diet, we must extend the same care and attention to our respiratory system. This awareness empowers us to make informed decisions about our health, from seeking timely medical care when needed to adopting preventive measures that safeguard our lungs and those around us. Section 2. Empowering yourself with knowledge and action. Knowledge, as the saying goes, is power. By understanding the causes, symptoms, modes of transmission, and preventive strategies associated with bronchitis, we equip ourselves to make informed decisions that protect our respiratory health and the well-being of our communities. We've learned that acute bronchitis, often caused by viral infections, spreads readily through respiratory droplets, reminding us of the importance of hand hygiene, respiratory etiquette, and vaccination as our first line of defense. We've also delved into the realm of chronic bronchitis, a condition fueled by prolonged exposure to irritants like cigarette smoke, emphasizing the need for smoke-free environments and responsible workplace safety measures. But knowledge without action is like a car without an engine. It won't get you very far. Armed with this newfound understanding of bronchitis, we must translate awareness into action, adopting preventive measures, seeking timely medical care, and advocating for policies that promote respiratory health. Section 3. Bronchitis, a shared responsibility for respiratory health. Bronchitis, while often perceived as an individual health concern, highlights the interconnectedness of our well-being and the shared responsibility we have in safeguarding respiratory health within our communities. Just as a single cough can release a chain reaction of infection, so too can our collective actions create a ripple effect of protection. When we prioritize hand hygiene, we're not just protecting ourselves but also those around us, particularly vulnerable individuals who might be more susceptible to severe illness. When we get vaccinated, we contribute to herd immunity, creating a safety net for those who cannot be vaccinated for medical reasons. Beyond individual actions, we must advocate for policies that promote respiratory health, such as smoke-free public spaces, stricter air quality standards, and accessible health care for all. By working together, we can create environments that support healthy lungs and reduce the burden of respiratory illnesses like bronchitis.